I'm going to be providing perineal care to a resident who is incontinent. Hello Trixie, my name is Danielle. I'm going to be your CNA today. I'm going to provide some perineal care. I'm going to go collect my supplies and wash my hands. I'll be right back, okay? Hello Trixie, I'm back. Just going to set up your supplies and then I'm going to go grab your tub of water here. Got your tub of water. I'm going to close the curtain for privacy. And I'm going to move this table over here. I'm going to raise your bed up. I'm going to have you check this water, make sure that it's not too hot or too cold. How's that feel? Okay? All right. I'm going to put the washcloths in. Going to fold them into fours. And you can put all four of them in the wash basin. I'm going to prepare my pad. I'm going to roll it. And you want to make sure that when you're rolling it up, that it's not touching your body. You can either roll it towards you or away from you, whatever is easiest for your technique. I'm showing you both. You want to make sure that you're not flailing around the fabric for infection control reasons. All right, Trixie, I'm going to have you roll to your side. I'm going to have you come towards me. You want to make sure that when you roll them that they're in a safe position on the bed. I'm going to have them bend their knee closest to me. And I'm going to have you reach for the other side of the bed. 1, 2, 3. And you want to keep them covered for dignity. And I'm rolling up the incontinent pad that's underneath her. I roll it away from me for infection control reasons. I'm going to set the new one down. Trixie, I'm going to have you roll on your back. You're going to feel a big bump, okay? 1, 2, 3. I'm going to position her a little bit more towards the middle of the bed. And I'm going to have her roll towards me. She's going to bend this leg and reach towards the edge of the bed. 1, 2, 3. And I'm going to remove, make sure you keep her covered during this for dignity. Remove the dirty linen, and you're going to put it right in the clothes hamper. And unroll the other one. All right, Trixie, I'm going to have you roll on your back. I'm going to bring down her sheet to about her knees. I'm going to take her towel and bring her gown up and drape it over her knees. You want to make sure that you do not get her clothing wet during this procedure. You're going to take the first washcloth, wring it out, and you're going to put soap on all 5 of these corners here. And you're going to create a good lather. It's important to have it folded in 4, and you're going to hold it down at the corner where the fold crease is at. I kind of do 3 fingers on the back and 2 fingers in the front, and you're going to tell the resident you're going to touch part of the perineum, the upper part, and you're going to separate their labia, and you're going to wash down the center with this first leaflet, right down the middle. Then you're going to fold this end, grab it with your thumb. You want a new clean surface before you go to on each side of the labia. So I'm going to the other side of the labia, and you're going to fold it again. Other side of the labia, and fold it again. As you can see, I'm wiping from front to back. You never want to go from back to front. I'm going to go to the groin. I'm going to ask her to spread her legs just a little bit for me so I can get her groin. And then I'm going to fold it and use the back side to do the other groin. And put this in the dirty linen. I'm going to take 1 to rinse. Same situation. Grab the crease of the washcloth. You're going to start with the middle, in between the labia, down the middle. Fold it over to each side of the labia. Then the other side. Then you're going to go to each groin. And then the back side is going to be the final groin. And you're going to put this in the dirty linen. Next, you're going to take your towel and you're going to pat dry. Again, going from front to back. I'm going to cover her up, and we're going to roll her to her side to complete the perineal care on her back side. Again, she needs to come to the side of the bed. We'll have her raise her leg, and you're going to roll her. At this time, you can have somebody assist you to hold the resident up in place. I'm going to get a washcloth. I'm going to lather it with soap. Again, the 4 leaflet. You're going to starting from the rectum, and you're going to go up the back, so front to back, going down the middle. Fold it over. Get one of the cheeks. Fold it over. You always want a new surface of the washcloth. The other cheek. Fold it over, and then again, finally down the middle one more time. And then dispose of that into the dirty linen. Take the final washcloth. This is to rinse. Down the middle. A new leaf corner. Down the cheek. Fold it over. Other cheek. Fold it over. And then down the middle again. Remember, always go front to back. And I'm disposing that in the dirty linen, and you're going to pat dry. And put your towel in the dirty linen. At this point, you're going to roll the incontinence pad because it will be soiled or wet at this time. You're going to replace that with a new incontinence pad. And have her roll. Trixie, we're going to roll on count of 3. 1, 2, 3. You have a bump. Just move her to the middle of the bed. I'm going to raise her leg. Have her reach towards me and have her roll towards me. Remove the incontinence pad. That's dirty. And you're going to put that in the soiled utility. And you're going to unroll and have her roll back to her back. I'm going to lower the bed. I'm going to give her call light. I'm going to have to go around. There you go, Trixie. Is there anything else that I can do for you? All right, you let me know if you need anything. I'm going to just go take care of my supplies. Thank you. I'm going to move the table back. And I'm going to take care of my supplies. I'm going to dump my water into the sink. I'm going to turn the faucet on. Get some water to rinse it out. Dump that out. Grab it with a paper towel. You're going to clean the outside. Dump that in the trash. Grab a new one. Clean the inside. You're going to take care of this. And then I'm going to take my gloves and wash my hands, and I have completed my task.